to do your chest physiotherapy performance evaluation, you're not going to do the whole patient care process, okay? So I'm assuming you've gone through chart review and subjective and objective data gathering, and introduce yourself and all that kind of stuff to the patient. So that's all part of the process. We'll talk about that later. So when you do your performance evaluations, you'll be doing 2 positions for us. Okay, 2 of these positions I'm going to demonstrate for you today. So we're going to do the first position here. So one of the first things that I have to show you how to do is get the bed into that position. Okay. So when you're filling out your form, if you're going to do it today, okay, you've got a column that says the position of the bed, and then you've got another column that says the position of the patient, and then you have another column that says where the pillows are located. Now just take note that sometimes you're draining 2 things at the same time, okay? So this first position that I'm going to place him in, you're just going to drain both anterior segments. So it's the anterior segment of the right lung and the anterior segment of the left lung. Okay, so both of those are drained at the same time. I think your form is divided up as right lung upper, right lung middle, right lung lower, and then left lung lingula, okay, upper lung lingula, and then left lung lower, okay. So in this first position, find where it says right lung lower lobe anterior, okay, and left lung lower lobe anterior, okay. See that?
Yeah.
This is the position for both of those, okay? It's on the board right there too. So it says it's both lower lobes, anterior segments. Okay. You've got all these slides as well, so you can double check to make sure you've got your form filled out right. So I have to get the bed into this position. So the bed's going to be flat, but the feet are going to be higher than the head. And the patient will be supine, or on their back. So in order to get the bed to do what it's doing in the picture, you have to raise the bed all the way to the top. Yep. Of course, we have the side rails up. I always leave the side rails up because I don't want to forget and walk around the other side of the bed and have it down. The bed's kind of high. Also, I'm tall, so I can reach over the side rail. Now, if you have to put the side rail down to reach over, make sure you put it up before you go around the other side of the bed. Don't leave the side rail down with the patient like this. Okay. So, bed's all the way up, as high as it'll go, and then you're going to go to the bottom of the bed, and there, underneath here, there are 2 little switches. One shows somebody with their head down, and one shows somebody with their head up. I want you to pull out the one that's got the picture of the guy with his head down, okay? So if you look at the bottom of the beds here, you can see that. So I'm just going to pull this out right here. Okay, and it pulls out and it stays out, okay? Now what I'm going to do is start lowering the bed. It's going to latch, and the head's going to start to tilt down, okay? I'm just going to start to lower it now. So it's starting to tilt. I'm also going to put the head of his bed down because I need him flat. Here we go. Ready? You're going to make it go as far as it'll go. Please be careful. Watch the top. Make sure nothing's banging against the wall or anything and ripping stuff off the wall. So this is what we would call full Trendelenburg. So he's in the Trendelenburg position. Okay. His feet should be approximately 18 to 20 inches above his head. Okay, so I'm going to slide right there. Some of the beds have gauges on them that show you the degrees or the inches, okay? But basically you're going to put the head down as far as it will go. That's going to be your first position for your patient, okay? So the bed is flat with the feet 18 to 20 inches above the head, and the patient is supine. So I need 2 pillows now. one under his head and one under his knees. We always want the knees bent to take the strain off the abdomen and the back. Okay? And if the patient's coughing, you always want their knees bent. I don't know if you've ever been laying in bed and you've coughed with laying flat and felt that strain across your stomach muscles, you know? Pretty painful. So whenever your patient's coughing, you try and keep their knees bent, or even have them pull their knees into their chest, especially if they're on their side, you know. Or if he's coughing, I can help him sit up to cough. All right? Because sometimes this really makes your patients cough, because the objective is to clear secretions into the main airways. So what I did right now is I positioned him. Here's your lungs. Hold your lungs. There you go. Okay. So I have him positioned so I'm draining the yellow ones. Okay. So just a little bit. There you go. See these yellow ones? These are the anterior segments of the lower lobes. Now the reason I have to get him to tilt this way is because these airways right here, these two, have to be straight even with the ground. Okay? So they're not going to drain like this. I have to tilt this so their two are aiming straight down. So any of the secretions that are in these superior segments will drain down into the main airway so he can cough them up. So I'm trying to drain these two right here. Okay? That's why he's like that. Borrow your lungs for a second. Thank you. All right, so now I could leave him in the drainage position, or I could assist in moving secretions by doing percussion, so that's what I'm going to do right now. So I'm going to find the lower edge of his ribs, okay, and I'm going to place one hand on each side. Ready? You got to do that for 5 minutes. Or you can use the little percussion cup. That works, and they come in a whole assortment of sizes, from little preemies to big adults, okay? Or we could do the massage. You're gonna like this. So this runs off of 50 psi. I've got my flow meter open all the way. Ready? You like that better? Yeah. Okay. That's a lot easier for me too. Patients love this. But for your performance evaluation, you'll have to demonstrate with cupped hands.
5 minutes?
No. Just so I know you got the technique down. Okay. After I'm done with my drainage position and my percussion, then we do the vibration. Okay? So I'm going to place my hands here. I would like you to take in a deep breath, and when you exhale, you're going to go through your pursed lips. Okay, ready? Feel your empty. Okay? And I'll do that 2 to 3 times on each side. All right? So that's our first drainage position. Only 11 more to go. Okay. So then the next thing I'm going to do is I'm going to have him lay on his side. So I'm going to move him onto his left side towards me. So roll towards me, please. It's going to be underneath your head, but not your shoulder. Okay, there you go. And this is going to go between your knees. Okay? So when they're on their back, pillows under the knees. When they're on the side, the pillows between their knees. Okay? So now, he's laying on his left side, so I'm draining the right lung, the lateral segments. Okay? So, this is your right lung. So, it's this right here. This is what's draining, that dark brown one. And I'm draining the lateral over here. Okay? first he was like this, then he's going to be like this, and then he's going to be like this, and then he's going to be like this. Okay? So you're spinning the patient. Thank you. So once again, I'm going to be on the lower border. You can just pull your arm up like that. Okay. I'm going to be a lower border of the ribs. Okay? You can use one hand. Okay. If it's stinging, you can put a towel down or something like that. But you have to do pretty hard. Okay? Because we're trying to loosen up secretions. And then the vibration. All right? And then I'm going to have my patient roll onto their stomach. There we go. Okay, so roll onto your stomach. I'm going to take this pillow, because we don't want a pillow under the head when they're on their stomach. If you're too close to the headboard, you can sit down. Okay, and then I need you to lift up your hips. This is going to go under your hips. There we go. And then lift. Comfy? Lay down. And then lift up your feet. There. Okay, good. So his knees are bent again. Okay, so now pillow under the hips so the back's not swayed. Kind of keeps the back straight. And pillow under the feet so the knees are bent. So now we're doing back here. So what's back here? Posterior, right? Posterior. Yeah. So now he's like this. I'll show you in just a second. Okay. So we're doing these sections right here, these big sections right here, the posterior area of the lung. These right here. These two orange ones, okay? So that means that he's on his back, so these posterior ones back here are draining. One of these two. One of these two. Okay. So where do I percuss? Yeah, the bottom here. Okay. So find the bottom of the rib cage. Right at the bottom of the ribs. And then finally, I'm going to have him roll on his right side. So can I have the pillows? Yes, sir. One under your head and one between your knees. And what I will do now is go around the other side of the bed. Because when you're doing this, you always want to see the patient's face. Okay. So, in case his lips start to turn blue or he gets short of breath or something like that. So you should always be on the side where the patient's facing. But since she's videotaping, I'm just going to stay over here.
Do you have to do vibration after
After each time you do place them in the drainage position, you do the percussion, and then you do the vibration. 2 to 3 times while they're exhaling through pursed lips. Okay, so same thing now, I'm still on lower lobes. So I'm going to be here on the lower part of the chest, percussing here, but this is the tricky one now. Okay, so what am I draining? Left lateral. This is true, but I'm also draining the right medial. So I'm draining this one, which makes sense to me. Okay, that one, just like I did when I had it on the other side, but the right lung has this. The left lung doesn't have this. The right lung has a medial segment. These airways are pointing this way. Okay? So I have to turn the patient like this to drain. This airway is pointing the opposite direction. Okay? So when he's laying on the right lung, he's draining the right lung. It's the only time you're laying on the lung you're draining. Okay? This is the tricky one. Okay, so this is the one they always like to ask about on board exam questions and final exams and things like that. All right. So left lateral and right medial. So we're laying on the lung, we're draining plus the one that's up. Usually you're draining the area that's up. Here we're draining the area that's up and we're draining the area that's below. Okay. So medial, the lower lobe, the medial segment of the lower lobe. So when you look at the diagram, okay, you're draining the lateral, but you're also draining this medial one as well. Okay, so you're draining both of these. That's the tricky. All right. So what we've done so far is he's on his head, his feet are up 18 to 20 degrees. He's on his back, he's on his side, he's on his stomach, and he's on his side. So we spun him once, right? We got almost all of the lower lobes done. What are we missing? We have anterior, lateral, posterior, and medial. Superior. Okay. We don't drain the superior like this. Okay. Superior has a different position. Okay. So I'm going to have you roll on your back again. Okay. Scooch down. I only want your head on the pillow.